On this week's episode of the Best of Johnston County podcast, we have our first episode with Tom Williams, the CEO of UNC Johnston Health. We talked to him about his growing up in the Bunn area of North Carolina near the Mudcat Stadium, as he says, his decision to go to Durham Tech and get a two-year degree, even though he could have gone to NC State or any of the other major universities, his time working as a respiratory therapist, and how he evolved into hospital administration as his career moved on, and why he decided to get into hospital administration. And he actually says it was kind of by accident. We also talked to him a little bit about the expansion plans, including a brand new patient tower behind the hospital in Clayton. So if you're interested in Johnston, UNC Johnston Health and where it's going, you're going to enjoy this podcast, so listen in.
Welcome to another episode of Best of Johnston County, brought to you by Breeden Law Office. Our host, Jonathan Breeden, an experienced family lawyer with a deep connection to the community, is ready to take you on a journey through the area that he has called home for over 20 years. Whether it's a deep dive into the love locals have for the county or unraveling the complexities of family law, Best of Johnston County presents an authentic slice of this unique community.
Hello, and welcome to another edition of the Best of Johnston County podcast. I'm your host, Jonathan Breeden, and on today's episode, we have the CEO of UNC Health Johnston, Tom Williams. We're going to do two episodes of him. In this first episode, we're going to talk to him a little bit about his background as a respiratory therapist, how he got into the hospital administration business well over 20 years ago, some of the things that UNC Health does, some of the services it provides, and other interesting things about the hospital that people may not know, including like exactly what is included in UNC Health Johnston. And then we're going to do another episode that'll be out in a few weeks where we talk to him a little bit more about what's going on in healthcare, the consolidation of healthcare, the certificate of need laws in healthcare, and stuff like that. So be checking in on that one in a couple of weeks when we get his answers on some of those. But before we get to that, I'd like to ask you to like, follow, and subscribe to this podcast wherever you see it, whether it be on Apple, Spotify, YouTube, TikTok, LinkedIn, or any of the other social media channels of the Best of Johnston County podcast. The Best Johnston County podcast comes out every single Monday and has now for right at 2 years. And we had a lot of great guests. And so if you love Johnston County as much as I do, this is the podcast for you. Welcome, Tom.
Glad to be here. Thank you for asking.
Thank you. I appreciate you coming. When I saw April cover at the J Now Awards Bank, one of the J Now Awards receptions back in July, I'm like, April, I need you to come be on my podcast. She was like, not me. And she's like, I was like, well, you got to get me somebody from the hospital. She said, I'll get you somebody. And I didn't know she was going to get me the CEO, but she did get me somebody.
Well, she knows I love to run my mouth.
Is that what it is? Well, the other thing is I know she's an attorney, and a lot of people don't know that, but she probably was smarter than the rest of us and never actually practiced law.
Yeah,
or didn't practice for very long.
She is a Wake Forest attorney, but we do not hold that against her.
I'm always asking her, like, you sure you don't want to come back and practice law? I've always got a job. And she's like, I don't want to practice law.
I can't believe you're right here to start and trying to recruit some of my best
I know, right? She's like, she does not want to practice law. So anyway, tell the audience what's your name and what you do.
So Tommy Williams, I am the CEO and president of UNC Health Johnston. I came to Johnston in 2019. I have worked in healthcare my entire life. Do you want me to go into where I grew up and kind of how?
Sure. I mean, everybody, I love those stories. I really do.
So I grew up right at the southern point of Franklin County in the Pine Ridge and Pilot community. Most people, when I say that, they'll say, where's that at? And then I say, well, it's near Bunn. A lot of people say, where's that at? And I'll say, well, it's near the Mudcat Stadium. A lot of people know where that's at. And that is where I call home now. I grew up, my dad, he worked with the Department of Transportation. My mom worked for the Agriculture Extension Agency out of Lewisburg. And my dad was also a farmer. So I grew up priming tobacco and working on a farm every day to the week. And when I was in high school, I was fortunate. I was a really good student. And I actually applied to NC State and UNC and Appalachian State. And got accepted, but I had no idea what I wanted. I was like any other, like I'm getting out of school. What are you going to do?
Right.
I don't know what I'm going to do. But the school guidance counselor there at Bunn High School sat down with me when I was a senior. And she was like, what are you going to do with your life? I don't know, going to school. And she said, you don't want to be a farmer? And I was like, no, don't think so. And she said, well, you should look into respiratory therapy. I was like, I don't even know what respiratory therapy is. And then, so she set me up as a job shadow as a student, and I went to WakeMed and spent a day there with respiratory therapy. I literally left that day, said, I'm going to be a respiratory therapist. I was blown away. Just the work in the hospital, the excitement of the hospital, the people in the hospital, and I knew that's what I wanted to be. So that's what kind of started me off in healthcare.
Oh man, that's wild. And you went to Durham Tech, I think,
I
to get
did,
that respiratory therapy.
I will say this, that because I know some of your listeners may know Sam Thornton. Sam Thornton lives in Four Oaks. He's a respiratory therapist, and he works with us at Clayton. And he's our manager of cardiopulmonary services now. He was the young respiratory therapist that they put me with that day. And I shadowed with him, and now he and I work together.
Oh, how about
which
that?
is just incredible. Kind of, it's funny how things circle back around.
Well, and you got started with a 2-year associate's degree, right? That's how you got your first job.
Absolutely. And I tell everybody, of course, I serve now on the JCC Board of Trustees. We're so fortunate. We've got such a wonderful educational institution here in Johnston County. I love JCC. It's amazing what Dr. Lindquist and his team are doing there, and expansion, trying to keep up with growth just like we are. But yeah, I went to Durham Tech, and because I kind of checked around all the different schools at the time, there weren't many respiratory therapy programs in the state. Now, this was back in 1982. So I decided to go to Durham Tech. It's the best thing that ever happened to me. One, like everybody else, I was actually 17 years old when I graduated high school, and because I have a late birthday in October. So being 17 and, I was a knothead like most young 17-year-olds are. But kind of, it woke me up, it grew me up, put me on a track. I think it matured me, and I learned so much. But yeah, I tell everybody, community college is the best deal going.
Absolutely.
It is the best
Absolutely the best deal going. I was on the JCC Board of Trustees from 2015 to 2019, and that was a great experience. I learned so much, and we were growing then, and they're growing even more now. I think I just saw 6,500 degree seeking students this fall. When I was on the board 7 or 8 years ago, it was like 4,200. So, I mean, it's so much bigger than it was. And it's really amazing. And I learned so much about everything that Johnston Community College did and the community, and, big support. I'm glad you're on that board because, we needed people from all the different industries, and that's great. And I'm a big believer in JCC and what it does. The tuition, if you're a Johnston County High School graduate, is free for the first 2 years.
Free. The commissioner's promise.
The commissioner's promise, and and then you can go get your 4-year degree somewhere else, because you did not immediately get a 4-year degree. I don't think. I think you started working and went back to Wesleyan 20 years later, right?
I did. In fact, it was, of course, like my counselor told me, I was like, big demand in healthcare, very affordable to go to school. And I knew, my parents, they provided well. They certainly weren't rich. I knew it was a lot of it was going to be on me to help, to pay for my education. So it worked out perfect for me. I worked on weekends. I went to school during the week. And then that was my plan. I'd come out and be a respiratory therapist. And then later on, my first job was at WakeMed. I worked there and worked for a while. Now I decided, I probably should go back and finish my 4-year degree. So then I started searching around and deciding, and I felt like the Wesleyan program worked out perfect. I'm local, Rocky Mount. I was born in Rocky Mount, so I felt like, that's a good fit for me. I got my business degree there, not because anybody asked me to, but it's just something I wanted to do. I wanted to learn and just keep expanding my knowledge. And Wesleyan was fantastic college, and I learned a lot there. And then when I got out from that, and it took me a while because I'm taking 1 and 2 classes at a time. I got married along the way, had 2 kids along the way, and my wife used to joke, because our first child, I was like, well, you guys will probably graduate from college at the same time, because it just took me so many years, and it's hard to do when you're working full time, you got a family, and you're going to class. And that was before online classes. I had to go in person from 6p to 9p at night.
Right.
And so you're working, trying to do all those schedules. And then later on, also, when I got out and got my bachelor's degree on business, I said, well, I would like to get an MHA. And that's what I did. I went to Pfeiffer for that.
Pfeiffer. Okay. Did you do that one online? Because Pfeiffer's not around here.
They had classes out in RTP. So
I didn't know that.
I would go out there when I got off work. At that time, I was working at Rex Hospital. So I would leave work, and then go out there in the evenings from 6 to 9. I was probably about halfway finished, and then they started the online classes. That was a godsend, because then I could do some classes in person, but also do some online, and I was able to knock it out.
And so an MHA is a Master's of Health Administration, which is I guess, how you started to get into hospital administration. But even before you had the MHA, I think you were already starting to do some hospital supervision type work. I mean, you were not just a respiratory therapist even before you had that master's.
Yeah, I worked, of course, at WakeMed for a while, and then I left and went to Raleigh Community Hospital, which is now Duke Raleigh. I worked there for 10 years. I was director of respiratory care and special diagnostics. It included heart and vascular services, echocardiography, stress testing, EEG, sleep lab. But I was a working manager. I covered those areas as well as managed it, and then went from there. Duke had a program, Big Duke University, I would call it Big Duke, Duke University at the time, where they were training respiratory therapists to sit on ECMO, which is the heart-lung machines. The perfusionists were training respiratory for patients that were needing heart transplants. So it was in the pediatric program. And it was an itch I had to scratch. I had to do it. I wanted to do it. It was something that I could learn. It's something I'd never done before. I went and interviewed for that job. They offered me that job that day. And I said a lot when I went back to what was then Raleigh Community and gave my notice. My dad even gave me a hard time about it. He worked with the Department of Transportation for 30 plus years. He was like, why you like your job? Why are you leaving to go somewhere else? Valid question. I wanted to learn, I wanted to expand, I wanted to do something else. So I did that, learned ECMO, became ECMO certified there at Duke, worked in that pediatric ICU for several years, really enjoyed that. Interestingly enough, my wife and I, she's a nurse, we were living in Cary, and then we decided we wanted to move back and get out in the country. So my dad at the time, he offered us some land that was farmland that was my granddaddy's. So we went back and built a house out there. It was an hour drive back and forth to Durham. I was working night shift. I was like, I can't do it. I'm going to fall asleep. And then I knew someone that worked at Rex Hospital. They offered me a job to come as Rex in 2000 as the coordinator of the heart station. So I came and took that job, and then I've been with UNC ever since.
Yeah, well, and in 2000, were Rex and UNC together at that point?
Yes.
Okay, I don't remember when that sort of
Yes.
started the merger, which ended up Johnston Health. It sort of merged in UNC Health too. I know it was about that time, So, well, that's interesting. So, why did you decide to move away from patient care?
I don't think it was a conscious decision. It's interesting. I've had people ask me, we do a lot of student shadows that come through, and it's one of my favorite parts of my jobs is talking to students and trying to get them interested in healthcare. And a lot of them ask me, when did you decide to be a CEO? And I say, I don't know if I ever decided that. And it's kind of by accident, because you work in a hospital, and I think I've always been curious by nature and wanted to learn something else and do more. And if you get comfortable in a job, it's really probably time to challenge yourself even more. And also, I always felt like Rex, if I'm being honest, probably gave me opportunities maybe I didn't even deserve, because there were things that, it's like things come up and it's like, well, we don't have anybody to do this. Well, okay, I'll do that. Let me try to do that. And I'll tell you, the first kind of to go back to your question, I was a cath lab director at Rex, and they were starting their plan to do suburban sites and expand into suburban. And my COO at the time, Steve Burris, we were having lunch together and we were talking about it. He was like, I got all these meetings and they're with contractors and we're trying to plan for CON, and I just don't have time to do all that. And I says, well, I'll do it for you. I've been director here for a while. Let me do that. And I actually told him, I don't know if this was a good idea or not. I says, let me do it, and you don't have to pay me anything extra. I just want to do it to learn it. And he was like, I can't turn that down.
That's right. You're going to work for free. Absolutely.
But, looking back on it, he gave me that opportunity and mentored me. And that's what's important. And I think there's a lot of opportunity like that in healthcare. And that's why I try to tell students and people coming through JCC, if you stand up and raise your hand and say, let me do that. And it's okay to fail. It would have been fine if I, after a month or two, went back and said, you know what, this ain't for me. This isn't working out. I got other things I could have done. So, but it did work out. And so it kind of expanded from there. So I think, the more you ask and the more you step up and the more you seek out opportunities, and healthcare is such a growing field, those opportunities will present themselves. So I think that's kind of how I ended up in administration.
So why did you take the job? I mean, you were number 2 at Rex, I think. You're number 1 at UNC Johnston Health. I mean, I guess this is a promotion, but I mean, you were going to have to come out here, new county, new employees, developing system.
It was, all that, but I was vice president of ambulatory
Right.
services and also had lab and radiology in the hospital. Loved it. Rex very good to me. And then we were opening up the new hospital out in Holly Springs. So it was a 50-bed hospital. So naturally, when I was working on that, we were in design for that. I called up Mr. Kyle McDermott here at Johnston and said, well, can I come to Clayton? Because Clayton was open and that's a 50-bed hospital.
Right.
I said, I really just want to spend a day there, walk it, talk to all your teammates there, ask them questions. What do you like? What do you dislike? What would you change about the design? Because we wanted to build off of what they knew at Clayton and put it in Holly Springs. So I spent the day here. And when I left that day and I got home, I told my wife, I said, you know what? I said, those folks over there at Johnston, the nicest people I've ever seen and worked with. I said, I bugged them and asked them 1,000 questions. Nobody told me to hit the road. I know how busy they were. Very kind to me, very nice to me, answered all my questions. I was like, it was a feeling of family and I couldn't get away from it. And I said, what a great group of people. I said, if something ever comes open at Johnston, I'm probably going to put my name in that hat. Well, interestingly enough, Mr. Chuck Elliott, knew him and worked with him many years. He had been the CEO for, I think, 10 years or more.
Yep.
And he told me he was going to retire. And so the initial conversation with UNC and Steve Burris, who was my boss at the time, I said, I don't know what y'all's plans are for the next CEO there at Johnston, but if there's opportunity to do an interim role, I'd like to do that because one, I'd learn a lot, but I would like to connect and be down there, and I'd still continue to work on this Holly Springs hospital. So that's what I did. And I got to meet, the board members. I talked to Dr. Janice was my first. He was the board chair at the time. And same thing, each and every board member I met with, it was just, we're so fortunate because we have board members of the community, give their time, love that hospital, love this community, and they just, embrace me. And I just, and I literally, when I started there, I came back to Steve, I said, oh, I'm totally going to apply for that job.
Right.
That's where I belong.
I mean, after about 6 months, they gave you the job, I think.
We did. So, and of course, in that process, COVID hit. We started through that. I don't want to talk about COVID. It gives me PTSD.
No,
but
it was a lot.
I will say a funny thing happened. I had been on the job for, I came in November or so. It was like March, April, May, June. We started having all the shutdowns and all the issues and everything in that time period. And I remember I was walking in with one of our environmental services teammates, and he was like, hey, he said, you're the new interim CEO? I was like, yeah, I am. He was like, why would you take a job like that here when COVID is kicking off? I kind of thought to myself, I went to answer him, and I thought, I don't know if I got a good answer for that. So I had to kind of think about it for a little bit. So, but it was a good process. But too, again, what you asked me what brought me here. It's the people of Johnston County and the board and our teammates. And I tell everybody in orientation, what makes a community hospital special is that, every hospital you go to, people take their jobs seriously. And we're really fortunate here in this area because, we got Duke, we got WakeMed, we got a UNC system. You land in any of those hospitals, people are going to take care of you. You're going to be good. They got cutting edge technology and you're going to be okay. Not every area of the country can say that. So we're very fortunate. And I'll say that, right up front. But when you're in a community hospital like Johnston, the people that you are taking care of, they're your neighbors, they're the people you go to church with, they're your family. You see them in the grocery store. That means a lot. That's special. And you're already accountable, but that holds you more accountable. Right. And nothing makes me happier for, I'll be at work and somebody will call my cell phone or text me and they'll say, hey, Tommy, my neighbor, my uncle, my aunt, my brother is in the hospital. He's in room such and such. Will you go by and check on him? That's what I like to do, and that's the connection back to like administration, but still that patient care touch. That's what keeps us going. The things I do with planning and strategy and spreadsheets, that's not a long-term makes you happy.
Right.
What makes you happy is working with our teammates that are so dedicated and working with those patients that are there that we're responsible for.
Right.
Have family law questions? Need guidance to navigate legal challenges? The compassionate team at Breeden Law Office is here to help. Visit us at www.breedenfirm.com for practical advice, resources, or to book a consultation. Remember, when life gets messy, you don't have to face it alone.
So the next question is, for people that don't listen, I mean, people live in Johnston County a long time. It was Johnston Memorial Hospital, and then we had this sort of merger, and I guess it is a merger. It could be an acquisition, depending on which word you want to use, by UNC Health of Johnston Health and its Johnston Memorial Hospital and its assets. So I guess, what is it? What is UNC Johnston Health?
So we are 100% owned by UNC, but we are Johnston Health Services Corporation. And Johnston Health includes not only the two hospitals, but also our SCCU hospice house. It also includes a lot of outpatient clinics. If you go to the medical mall, all of our outpatient diagnostics that are over there, wound care, radiology. It includes our early learning center that we have, also our Health Quest, the wellness center that we have. It also, in part, kind of includes a lot of the clinics because we have specialty clinics here. Two ways. We have UNCPN, which is the physician network of UNC, but we're responsible for all of those clinics that are here in Johnston County, and we work closely with them about expansion needs, recruitment of physicians, but not just primary care and urgent care, but also specialty care. We have orthopedics and OB and ENT and rheumatology and neurology, and I'm sure I'm leaving off some of them,
Right.
but we're responsible for all of them. And right now, about $11 million of the hospital budget goes to support the growth and expansion and the work we're doing in our outpatient clinics as well.
Yeah, well, and I've been fortunate enough to go to the ENT there across from the Clayton Hospital, and also if I have to go to urgent care, I go to that UNC urgent care right there across from the Clayton Hospital as well, and they always do a good job for me there, and you don't have to wait forever, and everybody's really nice. And so, and I know they got rheumatology in that office there across from the hospital as well. And then there's cardiologists and stuff in the building next to the hospital. Right. So there's all kinds of, and UNC is responsible for all of that as well. I'm right about that, right? Yeah. That's what you're talking about, right?
Yeah,
so
correct.
It's all under the umbrella.
And we partner with UNC and with UNC Rex. We have, back in 2021, we did a joint operating agreement with Rex. And really what that meant was, the majority, we have a professional services agreement with Rex to provide us with a lot of physicians, GI, heart and vascular that you mentioned, our hospitalist team that work there in the hospital, our neonatologists in our mother baby unit. All of these, we have our urology as well. But, and again, I apologize, I'm probably leaving out some of those guys, but we have a PSA with them. And the reason that is, it can be difficult for a small community hospital to recruit. And you have to recruit now nationwide to really attract, because there's so much demand for not only primary care docs, for APPs and nurse practitioners, and then any of these specialties. I mean, we've been trying to recruit for neurology and urology for over 2 years now. If you talk to Rex and the physician, even the private practices in Wake County, they'll tell you the same thing. We're trying to recruit. Everybody's trying to recruit. They're just not out there. So we got to recruit nationally. It's easier to recruit, as UNC and as Rex and as all of us together recruiting these specialty physicians. If you're graduating from UNC and I tell you, you're going to come and join a 1 or 2 member practice in Smithfield, you might be like, I don't know if I'm comfortable with that. But if I tell you, okay, you're part of UNC and it's a 14 member group and, or more, some of those groups are 40 members, but you're going to be practicing in Clayton and Smithfield. You feel better about that because you got a team behind you, and it's a little bit easier to recruit.
Well, I understand how hard it is to recruit. I mean, we all need talent. We had Stacy Beard from Novo Nordisk here a few weeks ago, and all she kept saying through both episodes we did with her is, "We're hiring, we're hiring, we're hiring," and you're hiring that too, right? I mean, it's all about talent, right? I mean, we're all trying to get talent.
We got a lot of growth coming up, and I'm sure we'll talk about that. But we were right at 1,500 teammates when I got here in 2019. We're just over 2,000 now. So even through the COVID years, we were hiring. We never froze hiring. We were hiring. Right. Why? Because as people that are listening to this, Johnston County is growing the way it is. So we are just trying to keep up. That's why, selfishly, that's why I got involved with JCC and on their board. I'm interested in what they do because we will take everything that comes out of there. I've told Dr. Lindquist, I want every one of your nurses. I want them all.
Right.
We hired 42 new grads this past year, 42, and it wasn't enough. So, and we hire from Sampson Community College, all surrounding. But WakeMed will tell you the same thing. Duke tell you the same thing. Rex tell you the same thing. We're hiring, because we need people, because we're keeping up with the growth. That's fortunate. One of the things you had asked me before, we turn on, what do you like about Johnston County? Well, the people, we talked about that. I love the growth, but it's a two-edged sword. I mean, I had traffic issues getting here as well today.
No,
so we all fuss about the traffic and the growth. I mean, there were fields. I passed fields coming here today that I used to bird hunt with my father-in-law. It's houses now. That's troubling, but but also think about, I got colleagues in the UNC system that their county is going the other way.
Correct.
And they're trying to figure out, how are we going to keep a hospital open? How am I even going to get an OB doctor to staff this?
Right.
They're asking how.
Well,
and we're growing and expanding. How are we going to get enough people to staff our expansion needs?
Well,
that's the problem.
Well, and I'm from Scotland County, right? And Scotland County has been losing population over the years. It has a great hospital there, but it's the same thing. Like, how do you, and they're closing schools because they don't have enough kids to be in the schools, where we can't build enough schools in Johnston County. So it is a double-edged sword, and you don't have to go very far to see counties in a different position, and small rural hospitals that are closing, and we don't have time to get into all that, and Medicaid expansion. We won't get into all that, in this. But
you like to keep this podcast positive, so
right.
we're not going to talk about it.
We're not going to get into all that. But one of the last questions for this first episode, and we're going to do a second one, so be listening back in a couple of weeks for the next one, is, what are the expansion plans for UNC Health here in Johnston County? I know they're going to do something with the hospital in Clayton, but I don't know what.
Yeah, so a couple of things are on board right now. And other expansion we've already done. We just finished up this past year our behavioral health unit in Smithfield. We were 20 beds. We're now 26 beds with that. And then so coming up in Clayton right now, we were successful. We petitioned the state, and I know we're going to talk about CON next time, for 24 more beds, which we were successful in getting after a couple of years of working through that. So we're in the design phase for that now. But a couple of things, and that includes both Clayton and also Smithfield. But we'll go to Clayton first. So right now, we have a CON to expand our Clayton ED by 12 beds. We should hear back from that CON by the end of September. And we have already designed, we've got the money and the capital to do that. And we will start and break ground on that immediately as soon as I get that CON certificate in my hand. We're ready to go on that. So that's planned. And then also, probably more importantly, and what your listeners are interested in, we're going to put 12 of our 24 beds, new licensed med-surg beds in Clayton. We have plans, we're in design phase right now for a new 3-story tower that is behind the existing tower. And we will do a consolidation of women's services. So all of women's services and our deliveries, labor and delivery, will be done in Clayton. The reason we're doing that is because it allows us to expand our heart and vascular and cath lab and our offerings in Smithfield. And we can talk more about that if you'd like to, expansion for that. But then the additional and we got CON approval for all this and that 3-story expansion. We will also go ahead and open up 12 observation beds, and then the 3rd floor will be a future shell space for 24 more beds. So when CON allows, or when we expand and can do it, we got the ability to add an additional 36 beds in Clayton. So all that's in the works. And then the other 12 beds that we got CON approved for, we will do some internal renovation in Smithfield and expand to add 12 PCU level beds, which are monitored beds. And that's for those patients there a little bit too sick to be on med-surg floor and not be monitored, but they're not quite sick enough to be in an intensive care unit.
Oh,
so there's a
in between.
Kind of in between PCU, progressive care unit. Basically, this means you're on a monitored bed.
Okay, well, that's cool. And anyway, you hear him talking about CON, and we're definitely going to talk to him about that in the next episode we do with Mr. Williams. But CON is certificate of need. And in North Carolina currently, if you're a hospital and you want to expand, you have to apply to the state to get permission to add beds and add services. And then the state decides whether you get to be able to do that or not. It is not just the free market. It's not just capitalism. I say it's similar to Russia's socialism. And we'll talk about next time. But they can't just do this hospital like they want. they have to get permission. And of course, when they go ask for permission, their competitors in the market try to convince the state that they're not needed and try to stop them. And I'm just glad that my competitors that do divorce law in Johnston County can't stop me from adding new attorneys and new services to my law firm. But anyway, the last question we'll ask everybody on these podcasts is, you've already alluded to it all the way through, what do you love most about Johnston County?
I love the people, and also my wife's listening to this. Her family's from Johnston County, and she actually grew up in Raleigh. When she was in high school, they moved back to McGee's Crossroads. So I have to say my wife's family is what I like most about Johnston County. But it's the people. The people is what matters, because, like I said, I grew up in southern tip of Franklin County. They embraced me when I came here. I'll never forget Mr. Ted Godwin. I was interviewing with him, county commissioner. He sits on our board. Yep. We talked a lot about growing tobacco and growing up on a farm and, kind of who I am and where I came from. And he looked at me and he said, I'll support you because you're one of us. And I got to tell you, I think about that a lot, and it meant more to me probably than anything anybody's ever said to me in an interview, because I felt like this is home.
No, it is. It is. And Ted Godwin, a previous guest on the Best of Johnston County podcast, been a county commissioner for a long time. And him and his wife were some of the first people I met when I got to Johnston County, and she was helping out at the branch up here at 4042. And she was almost like my mom when I got here. She helped me so much, and he did too. And I'll be forever grateful to them. 20 some odd years ago, young guy coming to Johnston County, I didn't know anybody. And she sort of took me in. I think she was like the customer service rep at this branch of Four Oaks Bank at the time. Yeah. So anyway, well, we'd like to thank Tom Williams for coming on to this episode of the Best of Johnston County podcast. He is the CEO of UNC Health Johnston. Like we said earlier, we're going to do a second episode, so be checking back in a couple weeks for that one. We're going to talk to him more about certificate of need and some other things going on with UNC Health. If you like this episode, please give us a 5-star review and share it with your friends and family members. Tag us in your Instagram stories, Best of Johnston County, because the way this podcast is going to grow is by you sharing and commenting and letting other people know about the Best of Johnston County podcast. If you love Johnston County as much as I do, this is a podcast for you. Thanks for listening.
That's the end of today's episode of Best of Johnston County, a show brought to you by the trusted team at Breeden Law Office. We thank you for joining us today, and we look forward to sharing more interesting facets of this community next week. Every story, every viewpoint adds another thread to the rich tapestry of Johnston County. If the legal aspects highlighted raise some questions, help is just around the corner at www.breedenfirm.com.